few newses for you. Please follow me. Iran and the US traded threats over critical energy infrastructure in West Asia, with Tehran vowing Sunday to retaliate if President Donald Trump followed through on a warning that he could target Iranian power plants. Trump said late Saturday the US would destroy Iran's various power plants, starting with the big Keystone first, if Iran did not fully open the Strait of Hormuz within 48 hours. Tehran dismissed the ultimatum as it launched a new round of attacks on Israel and issued its own warning. Ibrahim Zulfagari, an Iranian military spokesperson, vowed Sunday that if Iranian energy sites were attacked, it would strike more infrastructure in the region used by Israel, the US, and the American allies, such as fuel depots and desalination plants. Iran also said the Strait of Hormuz would be completely closed immediately if the US follows up on Trump's new threat. If the US threats regarding power plants are carried out, the Strait of Hormuz will be completely closed and it will not be reopened until our destroyed power plants are rebuilt, the military's operational command Khatam al Anbiya said. What about our PM's review? Let us see about the energy situation in India. As the West Asia conflict enters the fourth week, PM Narendra Modi on Sunday held a high level meeting to review the energy situation in the country. The meeting was attended by Defense Minister Rajnath Singh, Home Minister Amit Shah, Finance Minister Nirmala Sitharaman, and Petroleum Minister Hardeep Puri. Details is in the other page. Let me read out. Okay, next 25 key Bangalore cancer. Okay. See, Lamborghini seized after dangerous stunts. A simple news. The Kabant Park traffic police have seized a Lamborghini following a reckless drifting incident at the busy Anil Kumble circle. Police are currently probing whether Ricky Rai, son of the late underworld don turned philanthropist Muthappa Rai, was behind the wheel. The action follows a series of complaints regarding dangerous stunts on Sunday. This is the common incidents happening around us. Okay, about Karnataka's digital arrest cases, let me explain. Let me read. Digital arrest cases drop in Karnataka, but cyber crooks evolving. Despite massive decline in digital arrest cases last year, the threat posed by the infamous cybercrime still looms large in Karnataka, police say. According to an analysis by DH of the recent Karnataka Home Ministry data, last year witnessed a major trend both in terms of reduction of cases and the way this particular cybercrime evolved into weaponizing recent and real news to convince the victims. The data showed that cases across the state dropped from 1,129 in 2024 to 345 in 2025, a 69.4% decline. In 2003, there were 196 digital arrest cases. However, further analysis paints a darker picture. Despite the sharp drop in cases, the overall monetary loss in both years remained closer. Notorious crime. It involves scamsters posing as law enforcement officials, holding the victims under 24/7 online video surveillance, forcing them to empty their bank accounts. It is very common type of digital arrest. We need to be very careful about it. Okay, let me go for another page. See, this is very important about our health. One of the major health concern is cancer. Okay, let me read a little bit about it. Survey finds greater cancer awareness among people but poor uptake of screening. Screening is very essential for early detection of cancer and its treatment. MLC Ivan D'Souza released a survey report titled Insights and Aspirations, a promising new path in cancer awareness, 10,000 plus household cancer awareness survey report at the Mangalore Institute of Oncology on Saturday. The survey highlighted early diagnosis and prevention as key interventions that can significantly improve cancer treatment outcomes and quality of life. Conducted jointly by the Sanjeevani Cancer Seva Trust in association with MIO, the study comprised a comprehensive 20-question survey on cancer awareness among 10,948 participants across various sections of society. It provided critical insights into public awareness, prevailing myths, and barriers related to cancer prevention and early detection, said Dr. Suresh Rao, Managing Trustee of Sanjeevani Cancer Seva Trust and Director of MIO. The findings revealed strong foundational awareness about cancer. Over 90% of the respondents were aware that tobacco consumption causes cancer, and a majority understood that early detection improves curability, treatment outcomes, and survival rates. Many respondents also recognized that cancer is a non communicable disease that does not spread from person to person, reflecting the impact of sustained public awareness campaigns. Despite this awareness, fewer than 15% of the respondents undergo routine cancer screening. The main reasons cited were fear of diagnosis, yes, concerns about treatment costs, and the distance to treatment centers. Awareness of the HPV vaccine, which can prevent cancers such as cervical and certain throat cancers, remains moderate. The survey also found that many people seek medical help only after severe late stage symptoms appear. At the same time, several respondents reported engaging in self examination practices and being aware of healthy eating habits, the report noted. The report suggests measures such as subsidized screening drives, fear mitigating counseling, HPV vaccination awareness campaigns, and mobile screening and detection clinics to bridge the gap between awareness and action. MLC Ivan D'Souza noted that cancer cases were on the rise in the country and that people feared the high cost of treatment. I had urged the government to establish units of Kidwai Memorial Institute of Oncology and Sri Jayadeva Institute of Cardiovascular Sciences and Research in Mangaluru to provide treatment for the poor. As the cost of setting up such units is high, the government is considering entering into tie ups with private hospitals for treatment. He also appealed to MIO to collaborate with the government to ensure accessible treatment for patients. Really, cancer is a big health concern. We need to be very careful. Early screening, early detection is very important, and once it is diagnosed as cancer, early treatment really definitely it will prolongs the life and symptoms will come down. Okay, another news is about these accident cases. I'm not interested, just even political news I don't have interest to read. Okay, let me read this article. Create jobs. address education mismatch. And brother, don't you support anyone, brother? No. Politically, I am neutral. I don't support anyone, and I appreciate people who do good job, good work. India's economy has long been known for its inability to create jobs, and the education system for its inability to produce professionals qualified for their jobs. Though this may seem a contradiction, it is real and the country has not been able to resolve it. The State of Working India 2026 report, prepared by Azim Premji University, underlines the truth of these statements by highlighting the mismatch between aspirations and realities. It says opportunities for low levels of permanent, salaried, and white collar employment among graduates are shrinking, and fewer than 7% of male graduates were able to secure a permanent salaried job within a year graduating as of 2023. Every year, about 5 million graduates enter the workforce, but less than half of them find employment. Secure, well paying jobs are more difficult to get. The bigger picture is more unnerving. The country has 367 million young people between 15 to 29, adding up to about a third of its working population. Of this number, 263 million are outside the education system. See, and they need jobs which they can do unskilled, irregular, or informal. But such jobs are not available. The working age population is set to rise till 2030 and decline after that. No other country so many young people who need work and are ready to work. This demographic window considered India's opportunity is narrowing. Though India is projected to have a demographic advantage over other countries till 2055, it will be limited if most young people cannot find work or can only get work below their qualification. The mass of unemployed people will turn out to be a demographic burden, definitely, with economic, social, and political consequences. The challenge facing the nation is twofold. It has to create jobs in all sectors and at all levels to absorb the millions entering the workforce. Economic growth has been stable, but the sectors that create the most employment, such as manufacturing, have been stagnant. The challenge will turn harder with the advent of artificial intelligence concerning and other technologies that reduce the human component in work. The study says educational gaps of earlier decades are being bridged and gross enrollment ratios in higher education are in line with the country's stage of development. The second challenge, therefore, is to focus on employability. General, general standards of education need to improve. Vocational education needs greater priority and initiatives such as the Skill India Mission and the Prime Minister Internship Scheme call for more effective implementation. India needs a comprehensive strategy that links education with employment. So, guys, thank you very much for watching this live session. And tomorrow again, I'll come with the newspaper to read out. Those who have little time to read newspaper will get some news about the